I'm here with epidemiologist Bonny Specker, who is going to give us an update on the COVID-19 situation over the last week in our city, or actually in our area, in the state, across the nation, and in the world. Today she's going to talk about some articles, an article that came out. There was a press conference yesterday talking about COVID-19 from some individuals in Sioux Falls as well that she's going to discuss, and then a fun kind of experiential story about what's going on in different Scandinavian countries with COVID-19. So Bonny, what do you have for us today?
Thanks, Chelsea. Starting out with that new article yesterday that just came out in The Lancet, which is a really good medical journal out of the United Kingdom. But it looked at risk factors and disease profile post-vaccination in over 1 million UK users of an app that they have. And in that study, what they found is that people that were vaccinated, if you compared them to people who weren't vaccinated, there was a reduced odds of hospitalization or having more than 5 symptoms in the first week of illness. And that we know that. We've heard that a lot in the news lately. But the thing that I thought was really interesting was that those people that were vaccinated had the reduced long duration symptoms, that long COVID that we've talked about before. So even though there are some breakthroughs in infection with people that are vaccinated, they are hospitalized less, they have fewer symptoms, and now they're saying they have fewer cases of this long COVID. The other thing that happened yesterday, as you mentioned, was that there was a press conference held at noon, and it was the medical officers from Avera and Sanford, as well as the Sioux Falls public health official. And what they talked about was the need to refocus on COVID mitigation efforts, because South Dakota is seeing quite a large increase in the number of cases, and the need to increase vaccination rates to protect people. There also is some discussion of the long-term effects that they talked about. And this also came out yesterday, and I don't have the reference off the top of my head, but there is some things out about the kidney, the long-term effects on the kidney from COVID. And that is mentioned in this press conference yesterday. And the links here to the Kello coverage of that press conference is included. Moving to Scandinavia, I thought it would just be interesting to compare some of the Scandinavian countries. Here we have the United States. These are cumulative numbers of confirmed cases of COVID. And you can see that Sweden followed the US relatively close when you compare it to these 3 other countries, Norway, Iceland, and Finland. And if people remember back to when this pandemic started back in 2020, Sweden didn't have any lockdown measures. They were sort of thinking they would go for the herd immunity approach. And you can see that it pretty much followed what happened here. Norway, Iceland, and Finland, however, had quite a bit of restrictions. And just to talk about Iceland for a second, they've had pretty low rates all along. Just recently, they've had quite a large increase in the month of August in the number of cases. And they've managed to vaccinate a very large percent of their population. I think it's in the 70s. And because of that, what you see is very few deaths that have occurred in Iceland. We are getting a little tiny blip here from those initial cases, but what they did was they suppressed the spread of COVID through those non-pharmaceutical interventions, the mandates, the lockdowns, and then when vaccines came available, they vaccinated a large percent of their population, And now they're seeing cases, but those cases are much more mild and not leading to the deaths that we see in the United States and Sweden. All of these numbers are based on population size. So they're adjusted for the different sizes of the population. I'd like to spend a little bit more time on Finland and Norway and what they did. Norway, because there's so many Norwegians in South Dakota, I thought people might be interested in what their ancestors are up to. And Finland, just because they're talked a lot about. It's a neat country, so not Iceland's my favorite, but I thought I'd throw this up here. So here we have cumulative cases. This is per 100,000 population, as are the cumulative deaths and the average daily number of new cases. This is South Dakota data. We've had 14,000 cases per 100,000 population. And this is what the last 7 days have been as far as the daily number of new cases. And this is the United States. So we're a little bit lower than the United States. Overall, we've had more cases than that the US on average. We've also had more deaths. We've had, at the time that I made this slide, 2,067, whereas the US has had 656,000. And if you go down to Sweden, you can see that the cumulative number of cases is about the same as the US. The deaths are a little bit lower. That currently the average number of new cases per day is lower. And this is their total number of observed deaths. Finland and Norway both have very low numbers of cumulative cases, and their deaths per 100,000 population are like a tenth or more, smaller than the US and South Dakota. If I take the Norwegian death rate, I can figure out how many deaths would we have if we had the same death rate as Norway has had. And here in South Dakota, we've had 2,067 deaths. If you calculate it based on the Norwegian rate, we could have had 132. So it kind of shows what could have happened if we had responded like Norway had responded. Same with the US, 49,000 deaths instead of 656,000. That's a lot of lives that we're talking about. Even Sweden, if they had been more like Norway and Finland, they would have had a tenth of the deaths that they ended up having. So it's just interesting to look at how those rates compare and what would have happened if we had the same rates as Norway. So what did Norway and Finland do, or what are they doing now versus what South Dakota's doing? There are mandated measures in both Norway and Finland at the moment. And just to go back a second, these are the current rates. So they're about a fourth to a half of what we're currently seeing in South Dakota. Yet they have mandated measures. They have masking indoors and outdoors whenever there's other people around for anyone older than the age of 12. They have a 3-foot safe distance. We use 6 feet. Most of the Scandinavian countries are using a meter, which is 3 feet roughly. And then they also are restricting hours and occupancy of bars and restaurants currently. And they're also restricting the event sizes for both public and private events. And they have tracking apps that are used for contact tracing. And a very high percentage of the populations actually use that. That's something that the United States or South Dakota really hasn't done. And these apps will actually they keep track of where you've been. And then if a case is identified that had been in that area at the same time of you, it will notify you, and then you go get tested. So it's a way of picking up spread of these cases very early. If you look at vaccination rates, 62% of the Finnish and 65% of the Norwegian entire populations are fully vaccinated. This compares to 42% of the entire South Dakota population that's fully vaccinated. Restrictions within school, these are minimal, and it depends a lot on what level of alert that the schools are in. I did translate them. They were in Norwegian, so I spent quite a bit of time like cutting and pasting into translation app, and I do have those if anybody's particularly interested in knowing what they do. But masking is not a big thing in the schools. They count on the communities to protect the school children, and they do have like cohorts. So they use groups. They keep the same group of children together, throughout the day. So there's less interaction. South Dakota, I mean, we don't have anything at the state level, but there are local school systems that are right now mandating mask use. So what can we learn from these Scandinavian examples? I think there's a couple things. One of them is that it takes both community and school measures to control this pandemic. Finland and Norway do both, and they've been quite successful at it. But to me, a bigger thing is that there is a trust in the healthcare and public health institutions. So people listen to what the public health recommendations are. They believe the government, they believe the public health organizations, and they trust other members of their society. So that, there's not quite as much, if they're asked to do something, they do it for the good of their society. And so there's this whole thing of social trust within Scandinavia. And it's a pretty neat article if people want to read about it. That link is there. So moving on to what's happening right now, Brookings and South Dakota are not looking very good. The US and the world are looking better than they were last week. Here in Brookings, we've had a 50% increase in cases in just the last week. We had 94 new cases compared to 62 the week before. The test positivity, which is one of the things that goes into defining spread, is at 11%, so that's at a high level of spread. The age distribution of the new cases this past week in Brookings County, this information I get separate from the Department of Health. It's not on their dashboard, but they do provide it to us weekly. Excuse me, 26% of the children or the cases were less than 20 years of age. That's 28%. 49 were between 20 and 39, or 52%. 14 of them were between 40 and 59, and 5 of them were 60 years or older. So, 3/4 of the population of the cases were in those younger than 40 years of age. If you look at the hospitalization data, we've had 140 people hospitalized, 4 of them in the last week and 1 in the week before. There have been no new deaths for quite a while, fortunately. And as of yesterday, Brookings Hospital did have 1 patient hospitalized with COVID. And I've added Avera, McKinnon, and Sanford to this slide deck of slides, or whatever we're calling it, because they are local hospitals, and Brookings will transfer Brookings residents to Sioux Falls hospitals if they need more intensive care. Avera has 25 COVID patients, and 9 of them are in the ICU. Sanford has 54, 16 of them are in the ICU. And I have been mentioning Monument, in the beginning of August, I think they had 9 hospitalizations. Yesterday, I think it's in the 90s, or maybe even, I think it's in the 90s. And their ICU bed occupancy is actually at 107%. So they're in an overflow situation from COVID ICU patients. If you look at South Dakota, you can see we're getting a large increase here. This is similar to what it was back in early October of last year. We had close to 3,000 cases this past week compared to 2,000 the week before, and the test positivity is running at about 16%. And again, we want this test positivity below 5%. That's ideally where you want it. If you look at the 10 counties with the most populous cities, I've only included high spread here because it was getting too crowded by putting substantial and moderate down here. But you can see that all 10 of these counties except Beetle are in a high spread. This solid yellow line is Brookings County. This blue line here is Davison County or Mitchell. And up here we have Pennington County and Lawrence County or Spearfish. So there, the West River is still experiencing a much larger increase with Brookings and Davison County moving up as well, but not near what they are at. I've also started adding the student data. So this is over to the left here is K-12 and higher ed numbers for the entire state of South Dakota. In the last week, we went from about 150 K-12 students to 339 that tested positive. The staff were from a little bit less than 50 up to 94. And then higher ed numbers are down here where we have 58 students that have reported being positive and 31 staff. A couple things that are important to realize is that with higher ed, those numbers are self-reported to the universities. So they're counting on the students and staff to notify the administration if they test positive. But the K-12 data is actually obtained by from the Department of Health by the Department of Education, which then passes it down to the local school system. And if we look at the number of active cases in Brookings, this is as of yesterday, K-12, there were 13 active cases, 2 of them last week. So there, we've seen an increase there. And at SDSU, there were 17 active cases among students and staff. So these are active cases, these are cumulative for this state. The hospitalization data is really just mind boggles me, I guess is the way to put it. If you look at hospitalizations yesterday, there are 229 people hospitalized compared to 145 last week. So we have this increase here, currently hospitalized, that's this blue line. The total hospital admissions for this past week were 118 compared to 90. So that's this blue line, or the purplish one. This yellow line are the number of people in the ICU, and that has more than doubled from 37 last week, or the previous week, to 78 this last week. So as of yesterday, there were 78 people in South Dakota in the ICU with COVID. If you look at the age distribution of the hospital admissions, this is what has been reported nationally. We're seeing younger people being hospitalized in this wave of the pandemic. 3 of the people hospitalized were younger than 20 years of age. 23 of them were between 20 and 39 years of age. 32 of them 40 to 59, and 60, or about half of them, were 60 years of age or older. Last year, this would have been running more around 80%, like a high percent of the people were older. If you look at the deaths, we had 10 deaths in South Dakota last week compared to 3 the week before. That's little blip here, not quite close to where we were last year at this time, or in the fall anyway. which you wouldn't expect. Even if we have this increase in cases, the deaths are usually delayed by several weeks. The age distribution of deaths this past week, one of them was between 20 and 39 years of age, two of them between 40 and 59, and 7 of them were 60 years and older. If you look at vaccination rates, it's pretty much the same as it was last week. It seems like every week we're increasing it by maybe 0.1%. You know, so people are still getting vaccinated, but the numbers are relatively small. In Brookings, we have a higher vaccination rate in all age groups until you look at this 18 to 24 age group, where only 25% of the Brookings County population is vaccinated. So we have a lot of young people that are still susceptible, and this virus is so contagious, it's pretty much just gonna go through people and affect the people that are still susceptible. So if you look at the US, we have 40 million cases total. This past week, these haven't changed a whole lot. We had 1.1 million as of yesterday, for the week ending yesterday, and 1.07 the week before million. So it looks to be slowing down. If you think this is a line, it's pretty steep. This past 3 weeks, it's not quite as steep as it was here. This indicates kind of a slowdown. It's still increasing, but looks like it's slowing down. Here we have deaths. We have close to 10,000 deaths this past week in the United States. I mean, that's more than 1,000 deaths per day. It's 3 9/11s in 1 week. You know, if you want to think of it that way, I think people are quite numb to these numbers. The week before, we only had 8,000 deaths only. See, I'm even that way. Worldwide, we have 218 million cases, 4.56 million for the week ending yesterday, compared to 4.61 million the week before. So these are starting to slowly go down. The deaths are also kind of hovering the same or going down a little bit. 68,000 deaths worldwide last week and 70,000 the week before. So we have a small decline. So in conclusion, I just want people to think about this issue of social trust and belief in the healthcare and public health institutions and your neighbors. You know, we are a community, and we have good people in the healthcare system and the public health. So consider their recommendations. They are all now recommending non-pharmaceutical interventions in addition to vaccines to control the increased spread of this variant. That includes masking indoors, socially distancing, avoiding crowds and poorly ventilated spaces, and practicing good hygiene and monitoring your health. That's it for this week.
Thank you, Bonnie. I will see you again in a couple of weeks.